Hi, my name is David Emerson. I'm a long-term cancer survivor, cancer coach, and director of People Beating Cancer. Welcome to the blog post about risk of therapy-related secondary cancers. First, basic explanation of terms. A primary cancer would be the cancer that you or someone you love were originally diagnosed with. That's probably why you're here. Risk of therapy-related secondary cancer would be a cancer that resulted directly from therapies such as chemotherapy and or radiation. Throughout this blog post and this explainer video, I will use myself, my own therapy, my own cancer, my own risks as an example, but your chemotherapies, your related toxicity will also expose you, will increase your risk of therapy-related secondary cancer. So, let me explain. In my case, I was diagnosed with a blood cancer called multiple myeloma in '94, early '94. I underwent chemotherapies, but every chemo has different risk. In my case, vincristine, doxorubicin, Cytoxan, which is also called cyclophosphamide, busulfan, melphalan, and I had a lot of local radiation. Each one of those has their own risk. Each one of those therapies comes with a risk. Initially, by itself, chances are a risk of 1% or 2% annually is not that big a deal. However, 5, 6, 7 chemos, radiation, each, and that compound annually. In my case, it's been more than 25 years since I underwent therapies. The risk continues and gets worse. And research is not definite on this point. Some articles, some studies will talk about a 5 or 10 year risk. Some studies will talk about the late stage risks after, say, 15, 20 years. In my case, all of my chemo, it was a lot of toxicity, a lot of radiation. There is a late stage, a real risk, a growing risk of therapy-related secondary cancer. Therapies. There are no FDA-approved or conventional therapies shown to reduce your risk. There are a host of evidence-based but non-conventional, non-toxic therapies. Nutrition, supplementation, lifestyle therapies, exercise as an example. Curcumin as a nutritional supplement as an example. There are a host of therapies shown to reduce the risk of long-term cancer. In my case, it's been a long time. It's been years, more than 20 years since I went into complete remission, and I'd like to think that my therapies that reduce my risk of cancer are the reason why I have not developed a therapy-related secondary cancer. There's a risk there. I'm vigilant. I think that you too should be vigilant. I think that we should undergo our therapies daily, weekly, monthly. If you have any questions about those therapies, if you'd like to learn more, scroll down the page, send me a post or a question, and I will reply to you ASAP. In the meantime, thank you for your time, and be well.